Okay, so basically what we're going to know today is what is occupational therapy, or OT, what the whole rehabilitation team can do for you in your activities of daily living. I will also try to give you some alert sign. So you need to be conscious of some of the few things that if it does happen, you need to consult your doctor, your rehab team, or someone. So there is alert sign, and I want you to know them, and a lot of practical tips. Just so you know, don't go frantic writing everything. The presentation will be on the website. There's a live caption, so you can hear my talk back. And there's an email at the end. This is my personal email. You can write to me and say, I have this or this. Is there anything that you know? So I'll be glad to answer, and I usually answer in a couple of days. So there you go. So the primary goal of OT is really to enable or help people to get to optimize their social participation in daily living. And what does it mean? It's in specific area like eating, cooking, bathing, dressing, writing, preventing mobility and fall, home management, driving, work, leisure, and sexuality. So sexuality was addressed yesterday in another session. If you want to have more information about our occupational therapists, and also your whole healthcare team can help you with sexuality, you can also access it on the website in a couple of weeks. It will be on the Digital Academy. And Molly has convinced me to do a webinar. So I will do a webinar on sexuality in myotonic dystrophy. So it will be fun. The only thing I ask is that to misspell my name so my kids doesn't find me when they Google my name. You know, I said I would like so they don't hear me talk about it, you know. So apart from that, so one of the great challenge of your healthcare team and of your family, it's to understand that myotonic dystrophy, and you know it better than I do, have several clinical presentations. So one time it's a person, a 65 years old man that has very few symptoms, and the day after it's a very young baby that is severely affected by the disease. At another time, it's a 20 years old woman that start to have a little bit of difficulty to close her hand. So it's difficult to understand that a disease can be so much varied. But this is the same disease, but it's not the same management. So throughout this presentation, there may be things that doesn't apply to you and some of the things that do apply to you. So it doesn't apply to everybody, but I make it as general as possible so you can get what you need from that presentation. Before I go with the practical tips, as an occupational therapist, I'm very conscious about the environment you live in. And it's really important because it will also affect your participation. So for example, in Canada, we have a lot of services that are free. So that helps with a lot of services which may be more difficult to access in the US. So again, I give general advice about things that are in the US, in Canada, or in Europe, but it may or may not apply. So looking at services, support from friends and family that may vary from one family to another, what technology you can access, home adaptation, and also income and revenue, because that will play also a role on what you can access of what I will be talking today. So, what is the cause of my problems managing my daily life? And one of the first researchers in myotonic dystrophy and a wonderful clinician, Sir Dr. Harper, that is in the UK, I said that it was one of the most complex human disorder because every single system is affected or could be affected by myotonic dystrophy. And it's highly variable from one patient to another. The only thing that it's everybody or almost is the muscular system. But apart from that, if we talk about cataract, respiratory system, cardiovascular system, it may or may not affect you. And throughout the presentation, I will address some of those issues and tell you what we can do about it in our daily life. So the first one, obviously, the most important system in terms of activity of daily living is the muscular system. And what you can observe here, and I think I've got a little pointer here. Is that a pointer? No. Well, no. Okay, so is the progression of the disease. So you really have a distal to proximal progression, so from your hands and feet to your more proximal hips and shoulder. And again, some of the people will only be affected at the distal muscle, and it will slowly progress through proximal muscle, which means that at the beginning of the disease, you may have trouble, gripping thing, but further down, you will have difficulty to reach for the upper cupboard, for example. Central nervous system is also one of the major symptoms, and you need to be aware that you may experience some cognitive impairment. So some difficulty to plan ahead, some difficulty to do problem solving, a lot of cognitive issue, and you will hear more this afternoon with a great talk with 3 great researchers and clinicians. But one thing that may affect you is to understand doctor recommendation, and I will talk to it a little bit later about how you can help with this and how to put in place those strategies that your healthcare team is telling you to do. So sometimes it's difficult because you get to do problem solving, and at one point it may become more difficult. There's also hypersomnolence, the tendency to fall asleep, fatigue and apathy, and I will discuss that in a minute. The other point, or the alert sign that you need to know, not only as part of myotonic dystrophy, but being part of having a chronic disease. You may feel depressive symptoms or anxiety at one point or another in your life. It's very important to talk to you about it with your general practitioner or your healthcare teams. And as a spouse or as a carer, you may experience this as well. So you also need to talk about it. It's highly common in chronic disease that this may happen or not, so you need to talk about it. Now, going back to fatigue. We have done some research, and we have clearly showed that apart from muscle impairment or decreased muscle strength, fatigue is one of the main symptoms that affect your ability to do your dressing, washing the house, taking care of the kid, doing the cooking. So fatigue is a major thing. And fatigue can or may be alleviated to a certain extent with potential medication. So please report it to your doctor, and he can discuss some different therapeutic options. The other thing that can be put in place in occupational therapy is energy conservation technique. So it's really about helping you to better plan your day so that if you have a social outing in the afternoon, you don't start to decide to clean your whole house in the morning. That seemed like a simple example. But with your OT, you can better plan your day so you're able to do more of the thing that you like to do. Apathy, you may or may not have heard that word. It's really the tendency to have difficulty to initiate things. So you have to clean the house, you have to start to cook the supper, you have to do this and this, and yet you're not able to activate yourself to start this activity. And this was talked about between clinicians, but recently it's more and more part of the research perspective, and we've documented that there is a higher prevalence of apathy in myotonic dystrophy. And the thing that is important to understand is that it is a different symptom from falling asleep, hypersomnolence, and it's a different symptom from fatigue. So some people are apathic, they have difficulty to initiate activity, but they don't feel fatigue, or they don't feel that much hypersomnolence. So you need to think about all those symptoms as different, and they can lead to different therapy or different intervention. So you need to discuss with your doctor if that may happen to you. There is a trial right now in the European country. It's called Optimistic trial, and they are trying to work on a cognitive therapy so that it helps you to get going, so that little drive that you need to get going, there's special technique in cognitive behavioral therapy that may help you. So they're doing that, and it should be coming soon. And there are different symptoms from fatigue and hypersomnolence. So now getting back to the daily living strategy. So the first thing I want to discuss with you is eating, okay? So in DM1, there is a lot of people that may experience progressive difficulty with eating certain food, and that's what we call dysphagia. And this is related partly because there is muscle here, as part of the GI tract and as part of the swallowing what you need to swallow. That also decrease, so you lose strength. And there's also a GI tract involvement that will also make it more difficult. There is also difficulty handling cutlery because of the myotonia and the decreased strength, difficulty taking food out of your plate, and also a new thing you never heard because it's new, poor choice of food, okay? And we'll discuss all of this. So with dysphagia, what is very important is the alert sign, okay? So you start coughing during your meal, so you take a piece of something and you start coughing. You realize that you used to eat chips, cracker, hamburger or apple, and now you don't eat it as much. This is alert sign. You need to consult your doctor. You need to get a referral because the two things, you can choke, so that is one thing. But the other thing is that when you have dysphagia, there is a risk that the liquid that's supposed to go to your GI tract end up in your lungs. And that may lead to what we call a dysphagia-related pneumonia. And since pneumonia is the leading cause of death in myotonic dystrophy, you want to prevent this at all costs. So when you start to see that you're changing your food, that you're coughing more, you need to have an evaluation. And it's clearly, and there was some papers said that the patient tend to under-report it because they're used to it. They think that it's normal. It's not, and you need to prevent it. No, I mean, really, it is. Oh, whoops, sorry. So, I hate those things. Okay, so pneumonia, very important. Not part of daily living, but I always put it in my slides because I think it's very important. Get your vaccine every year, dysphagia assessment, and smoking cessation. We had some data that a lot of our patients are smoking. It's always a bad idea, but it's even a worse idea in myotonic dystrophy because it's the leading cause of death, so you don't want to impose on top smoking. Going back to eating. So dysphagia, you need to work with an OT, nutritionist, speech therapist. It depends on the country you live in. We can adapt the texture and let you know which are the good food you can eat and what the one that you may not eat anymore. We always teach the Heimlich maneuver, which is the maneuver if you start choking, it's the way to get the food out of your throat. And we also teach the patient about position while eating. So we do have adapted texture even for the more severe patient. This is not real food. It does look like real food, but it is puree food that is put into a regular appearance. And we had some at the clinic for some of our patients, and we do research program on other population, and it tastes very good actually. It is really good. Posture is really important. So you need to sit upright, so you don't want to eat in the couch or at other places. You need to stay seated for at least 20 to 30 minutes. It's very tempting to go for a nap after a meal. We all like that. It's not a good idea because of dysphagia, but also because of the reflux. So it may increase your reflux. A lot of our patients have reflux, and you need to have 20 to 30 minutes of sitting upright. So go for a walk, do something else, but don't go and lying down. You may also, as an alert sign, you see that it takes you more time to eat, so that's another alert sign. You need to decrease the size of your bite, so you're cutting things, smaller and smaller, which is a good thing, but that means that you need to consult. And you preventing now, and there's also food and liquid issue with that. Now, going back to eating, but taking cutlery. In occupational therapy, we can help you with thousands of things in regard to increasing the size of the handle of your cutlery, two-handed cup, DYSPHAGIA, which is a sticky placemate so that the plate doesn't move as much, and there's thousands of other options. So please, if you think that it's getting harder and harder, there's a lot of option for that. Food choices now. Very important. We had a doctoral student that made a project, and what we've seen is that a lot of our patients, partly because of dysphagia, partly because they have trouble to cook healthy meal or to get to the grocery shop, so they tend to eat not as good food and not as a complete choice of food. And what are the potential of that? Well, first is obesity. You have a disease that, decrease your muscle strength. If you are overweight, that will put an extra strain on your walking ability and your general health. So you should be careful of that. The other point I wanted to make, and that's my most important point, is maintaining your muscle mass. So the muscles needs proteins, okay? So it feeds up on protein. It doesn't feed on sugar. It doesn't feed totally on lipids as well. It feeds on protein. And if I stop eating protein, I will decrease my muscle mass as an healthy individual. And if you have a disease, then you need even more to make sure that at least that is taken care of. It will also help your intestinal transit with fibers and things like this. So, and there's a good presentation that is coming right now, so you can walk out. No, I'm joking. But there's a GI tract presentation coming also that is ongoing right now. And also energy level. Sugar has been shown to decrease your energy level in the long run. So if you're eating a lot of sugar, and sugar is everywhere now. I mean, it's everywhere. More sugar you eat, that will play on your level of fatigue and energy. Now, what I wanted just to show, this is based on the new recommendation. And what is really important is that it gives you how much protein you should eat. But what it really says as well is that if you have a chronic disease, you should eat more protein than what is in your healthcare recommendation. So you got the general food recommendation from your country. You should increase it if you have a chronic disease. And where do you get those protein? And by no means I'm an expert. I asked my I've got a student in nutrition, but please consult your nutritionist or your GP or your neurologist about it. But some, protein example, Greek yogurt, milk product, eggs, meat, tuna, almond. Now there's a lot of shakes out there. Be aware. Some of them are full of sugar and no protein. So again, you need to consult with your GP. What are the good options about the shakes? It's very tempting to take only shakes and to say, oh, it's done. But a lot of them are not as good as, and the other products are always better. But shakes can also be an option to increase your protein level. Dressing now. So dressing is also an issue. A lot of our patients are experiencing dressing problem because they have trouble to pick up small object or they need to sit while dressing, and they have also poor balance. Now, alert sign. So if it takes you more and more time to dress, you may need to consult. If you are not wearing what you used to wear and you're preventing yourself to, wearing dress and wearing those nice, shirt that you have with little teeny button, that's probably an alert sign that you need to consult. Now, this is my new sign now. So I always like to come to those conferences because then the people come to me and they say, oh, I've tried something new and you should put it in your presentation. So every year it gets better. So now the awards this year goes to Elizabeth because yesterday over a drink, she says, I've got that new trick for the kids. It's amazing. So those shoelaces there that you see, the top one? It's called Zubit, so it's going to be posted on the website. And it's a magnetic shoelaces. So it's your regular, laces, and you put this, and it's magnetic, so it just close together. And to open it, you just flex your foot, strongly, and it just open. And she said that it works wonder for her kids. So that's the trophy this year. So this is the thing. Next year, try to get the trophy, okay? And bring me some new trick. Bathing. Bathing is a major issue, not only because washing yourself, but getting in and out of the shower, in and out of the bed. And this is really important because there's a lot of fall that can happen in the bathroom, and you want to prevent this. So, alert sign. If your nails look like this, you may need an adaptation, So please do consult, So if you start to be afraid of getting in and out of the bath, and this may be, like you start to not bath every day, but every 2 days, and every 3 days, and every 4 days, because you're afraid of getting in and out of the bath or the shower. So there's a lot of home modification that you can do, and I'm just going to go to the image. So you can raise. There is toilet risers that can be bought, so it's easier to get up. There is also handrails that are very grab bar that can be. This is a bigger one. There's a smaller one, and this is A lot of things. So you can have a seat that you can sit on in the bath, an handheld shower. And what we have also is universal cuff. So you can put your sponge there, and you don't need to hold it while you're washing. So you just need to put that sponge in that universal cuff, and you can wash yourself. So it's very handy. Brushing feet, okay? So you have trouble to grip that, that brushing feet, and you are losing strength in being able to brush efficiently. So electric toothbrush are very effective. There are very expensive ones, but there's cheaper one. It's better than none, So there's like $6 going to $200, but this is very effective. And why is it important? And I'll tell you why. Well, first, you don't want to have that type of, cavities. But the other thing is that what has been found in the aging population, it's not been found in the DM1, but we never did research, but is that your mouth is full of bacteria, good ones, bad ones. But sometimes when you don't brush your teeth enough and you have cavities, well, what happens is that there's a specific bacteria that goes to your lung and get community-acquired pneumonia. And as I said, pneumonia is the leading cause of death. So you want to prevent this, and one way to do it is to have a good oral hygiene, apart from, social relationship and, the kissing issue and all this. But apart from that, you need that. Now, how to prevent mobility and falls. When do you need to see a professional for mobility and fall? Well, you don't want to stumble like this, The first time you start to trip on the floor, you just, you stumble, you trip, you go on the floor, you need to talk to your GP about it. You're not supposed to fall. This is not part, sometimes you do, but, you're not supposed. So you start talking to your GP or your rehab team about it, and then they can assess you and provide options. So you need to see a physio, first of all. Whoops. Because there is an increase around 10 times people with myotonic dystrophy up to, not at the beginning of the disease, but as the disease progresses, will have a higher tendency to fall. And this is the 5 tasks where falls happen. And we will go through all of them. So the first thing is, believe it or not, running or walking fast to get the phone, okay? So what I tell my patient is get those nice, how do you call it? I have my phone recorder, those that take the message. Okay, it's easy, so you don't need to run. And they leave a message and you call them back. It's an easy one, but sometimes you want to answer. Bad idea. The other thing is all the thing about electronic cords, things lying on the floor. That's the second reason why people trip. The exterior of the house is an important issue as well. So a lot of things you can do. You can do aluminum rails. One thing that is easy to do and it's very helpful is the step reflector. So in the light, it doesn't show as much, and in the dark, it glows. So if the lighting is not optimal or this, you can still see the stairs. Gradual thresholds are very easy to install, and they can be very helpful, so you don't have to step over, and it makes life easier. Now, the living room, again, a place where falls can happen all the time. So there is the loose rug. This is the OT first enemy. So I hate loose rug or any rug. So please fix them properly. We also have to place the phone next to the couch. And what we do, we also recommend sometimes power seats. So this is a seat that will lift up automatically, and it will help you to stand up. And the couch cane. This is not that's been around, and now we're starting to recommend it. But it's very nice because it's helped the person to rise from her favorite couch. There's also lifting chair, and that's it. Assessing the kitchen. So now, if you're up there to get to your cupboards, you need an assessment. There's tons of possible kitchen modification. Some of them are very expensive. Some of them are at the dollar shop. So if you start to have trouble to reach out for certain things, you can work with your occupational therapist to work on better solutions, and that's some of them. So oftentimes we do wall-mounted pot racks, so you don't have to lower down to get your, very heavy pot, so you put them on a pot rack. There's also pull-down glass rack, slide-out shelves. I love those. They're really easy and you can reach, and it's easy to get your thing. Assessing the stairway now, another place for fall. And sometimes, I don't know you, but my adolescents think that that's the place where they need to put everything. So let's say I say, can you bring that back to your room? And what they do is they take it and they put it in the stairs, and they leave it there. When they're gonna go up to the stairs, this is a major task, so they need to do it in 2 times. So what we do sometimes, what I advise the patient is to put a basket, and you put everything that you need to bring upstairs, and then at the end of the day, you can ask your husband, or you can do, smaller, but take the basket to bring it upstairs. So it's make it thing easier. Now, the bedroom is also a risk for potential fall. You need to locate your clothing within easy reach. So maybe you need to rearrange your drawers. And one thing that we like a lot is the head-to-floor pole. So this is a pole that is, going up and down. It's very safe, and it can help people to rise from the bed. A lot of our patients likes it, and it's very useful for them. Driving, is there an issue? So, you may be prone to hypersomnolence and to cataract, and you may wonder, or, poor grip. So yes, you need to be assessed for cataract regularly, so you know that you're able to see properly. And you also need to make sure that you can hold the steering wheel. But there is option, again, in occupational therapy if you're not able to do it as you used to do. So, and driving in sleepiness, there is no evidence that you're more at risk of falling asleep. This is not the situation when you tend to fall asleep. But if you start to feel that you're less, you feel more sleepy, please, be careful, and maybe you'll have to discuss that with your healthcare professional. And driving in cataract, you want to make sure that you're able to see ahead. Home management. So cleaning the house is a major, challenge in myotonic dystrophy as the disease progresses, and a lot of patients will experience, severe difficulty with this. And this is due partly to lower extremity strength, fatigue, decreased support from family and friends that used to help you, and also income can partly explain that, because sometimes you can get the services of a home, a home helper. But in Canada we do have certain restricted services, but that are free, so that people can ask for a person to come at home and help them clean their house. So that can be also very helpful. So the alert sign is that if your house looks like this, you may need to talk to your healthcare professional. And one thing that just came out recently, and we're going to try to alert the GP about it and the community, is that what we have shown with one of my students was that, that based on a grip strength, on a pinch strength, the pinch when the doctor asks you to grasp like this, if you go to a certain level of muscular weakness, that's an alert sign for the doctor to say, oh, you may need to have a team looking into your own management. So this is something we're going to try to train the healthcare professional to be alert, because a lot of patients won't disclose problem at home. You ask the patient, how is it going at home? Everything is fine. And then you do a home visit, and then you realize that, well, there's maybe a few things that we can help with. So this is where we want to alert the healthcare professional. This was a very cool trick that was given by a participant at a previous conference. And when you have those spray machine that, to clean or anything, so that's called snap and spray, and it's easier to grab and to actually do the motion. So it may also be a good trick. So what the OT will do, she will assess your residual ability, help you to get community services if they are available, and find tricks to help with cleaning. And there's a lot of tricks that you can use. Sexuality, as I said, I did present yesterday. My only thing that I will say today about it is really that if you have issue around sexuality, this is totally normal. First, because we all do at one point in our life, regarding intimacy or ability to do this and this. But please do talk to the person you feel the most comfortable with in your healthcare team. It may not be your doctor. I mean, I look around sometime and no, I don't want to talk to my doctor, but maybe your nurse case practitioner, or sometimes it's your OT or your PT or anyone in the healthcare teams. And then once the subject is brought up, then the person will be able to direct you to the most helpful professional regarding if it's a psychosocial issue or is it a physical issue. And please do, because there, again, tons of things that are available, and if you're interested, you can look at a webinar and the presentation I gave yesterday, and that's going to give you a couple of ideas of what we can do for you, but there's a lot out there. And preparing that talk, I learned a lot about what was available. I didn't thought that you could do all this. So it's, we all learned from that. Actually, my husband loved that I gave that talk. I'm getting more proficient now. I learned about all those things I didn't know. So, you say, you can do it next year as well. So financial management. Now, as the disease progresses, you may or may not have the ability to work anymore. That will put a lot of strain on your family life. But the other thing that may happen as well is that you will feel that it's getting more difficult to get that financial management done. You forget to pay your bills. You forget things, or it's getting more difficult to do it. And this may be related to your cognitive function that may, it is known that sometimes it may progress for certain patients so that you get more and more difficulty to do that. And there is resources that may exist in your community. So please talk to your healthcare professional or your social worker, and there is community resources that may help you to do a monthly budget, get with your bank so that you get automated services so the bills get paid automatically in your account. There's a lot of things that can be done. There's also applications so to help you to remind you a certain thing. But my word of caution is, because I was Googling in the US, just to see what was available. And there's thousands of sites, financial management will help you, blah, blah, blah. First, talk to your healthcare professional or your social worker, and they will help you with the trusted resources. Because there's a lot of people out there that may say that they're going to help you with your finance, and they won't help you. They will help their finance, but not your finance. So just a word of caution. There is very good, because some of our patients, they are linked to a community organization that help the general population that have trouble with financial management, and it's really helpful for them. Now, work. Work is another issue, as I said. There may be accommodation available. Please talk to your employer and to your healthcare team sooner than later, because accommodation, the assessment that needs to be done takes time. And there's also sometimes special programs. In Canada, we have a program that may apply to certain of our patients. So let's say they're only able to do 50% of the job. This program will pay the employers 50% of your salary so that you will still work, but they won't lose money. And that's very good. Not for all of them, but for some of them, it has worked very good. So it may exist, but you need to talk about it. Now, little words about about following up all your healthcare professional advice. And Jacinta Simpson is doing a talk as well on all this. But really, really rapidly, what you need to know is that it is very difficult to talk to your healthcare professional because we all speak jargons and we think that you understand. And it's a complex disease. And you need to learn a lot and a lot. Even our GP think it's complex. So, and I mean, they got medical, background. So you need to make sure you understand what your doctor says, and don't be afraid to say, I don't understand a word of what you've been saying. Can you please in a more common language? And they will respond to that. Bring a pair of extra ears. So that's Jacinta picture, but I love it with the rabbit. So usually in a regular consultation, you usually will be able to remember from 20 to 30% of what has been discussed in the doctor office the week after. So please bring someone so that you're 2, so that will make it 60. So that will be better, you know, or you will understand it differently. Make a list of your concern. What we say is that get a little book near the phone or somewhere, write down every issue you want to discuss, and write it right when you think about it. And when you go to the doctor, you've got your list prepared, and you know you can check things that have been discussed or not. And Jacinta said always to keep also your medical files with you, all your tests, all your things, and I think it's a very good advice. Get your family involved if you need it. Not only in the medical, you know, consultation, but let's say the physical therapist said, oh, you need to exercise. So get your spouse, get your friend, get your children to go with you and to do it together as a family, because it will increase your motivations, you know, and you will reach the target quicker. And I see them as the cheerleading team, you know, so please use them. Okay, so health literacy, that's a jargon word that we use, which is it really means that, and I will put it back to my own situation. When I go to the garage and my car is broken, and I've got a very old car, so he breaks all the times, and so I get there, and he does explain to me what's not working, and I don't understand a word. And the only thing I want is to pay and to get it fixed and go back home, you know. And I'm not really able to explain to my husband what was, you know, broken, but, you know, I just do it. But you cannot do that with your own health. You are the one that needs to understand what to do. And health literacy is the word to say that you're able to understand what we are saying to you. So it's the medical literacy. And it's very difficult. So please ask questions, ask the people to re-explain to you, and make sure you really understand, you know, all the little details that you need. Oops. The other thing that may come sometimes as a personality or personality style, but sometimes as part of the disease, there's a cognitive process that led to rigidity. So rigidity means that you are less inclined to take new options into your life, okay? And we are all rigid at some point of our life, and this morning I was just giving the example. I've got back problems, and my physio said that I shouldn't wear high heels. And I told her that it's a very good advice, but I don't think I'm going to follow it. So I've got my high heels. So we're all rigid at some point, you know. And the thing is that maybe your sister tried something and she was able, you know, to cross the wall, but it may not be your option. It may not be the one that worked for you. So you need to find the options, and you need to try new options. So we got a lot of our patients that, let's say we gave them a fatigue medication, you know, to get less fatigue. And after 2 weeks, they drop. Oh, it didn't work, so I'm not using it anymore. But please give time to try it out, see what's working, what's not working, and discuss it back with your clinician. So it didn't work for me. Do you have other options? Okay? And what may work for some member or some family may not work to other family. And so I've gave all kinds of advice, but you know, not all of them cost money, but some of them cost money. So please look for funding. You can talk to your social worker, to your nurse, or to your healthcare team and say, I would like to see if there's any program in your community, in your area. And there's a lot of there when you start to look into it. And so MDA program, insurance. And for the senior in the room, there's a lot of senior program. It's not because you have myotonic dystrophy that you're prevented to get into those programs. They're very, like the fall, there's a lot of senior fall prevention program, and they're excellent, and they will help you. So please look around to see if there is any senior program in your community and use them. This is more resources. At the end, there's my email. As I said, I will be very pleased. If you get a trick that you found tremendous and it wasn't discussed here because I don't have time to discuss everything, please write it down, and maybe next year you will win the trophy for the best tricks. And please let me know. And I think we've got I always leave sometimes for some questions. So if you have any questions, please do so. Or you can write it down and we can do it at the Q&A session at 5. Yes?
My son is driving on a whole
Yeah. Write me an email and I'll send you a link. And yes, there is modification for that. We do it at the clinic. The OT can link to your OT and they can discuss about the options. But yes, there is options for that. Other questions?
So I have some nominations for your STAR Award.
Oh, yes, you do great.
That are early. So there's a couple. One is on the your point about the shoes.
Yeah.
There's also a pair of shoes by Nike.
Yeah, true.
That are called LeBron James, and I guess it's more zipper and Velcro as opposed to magnets. So if you're in the shoe market. The second is many kids and adults with the GI issues, which you refer earlier. You know, there's both sort of adult diapers, you know, or diapers for young people, but someone has suggested sanitary pads, which are much smaller and skinnier and less bulky. And whether it's a teenage boy or a teenage girl, or whether it's a grown-up, it's a good option.
Yeah.
The third recommendation is about homeopathic options related to GI and diarrhea. And there are two resources that are recommended: Premier Research Labs and Premier Cleanse. And so again, it's a more natural option.
Yeah.
And the last one is a drug called mixilotine, which is helpful for myotonia, and it helps with issues of both the GI tract and myotonia and the ability to speak.
Yeah, true. That's true. That's
so I'm going to give you this
and I'm
for
put it in my
next year's
presentation.
PowerPoint.
And for the, for the diaper issue, in Quebec now they got a new company that do diaper, but really looks like very sexy underwear. I mean, they're amazing. They're really, really nice. And I found it very cute, so I'll put it in my presentation. And maybe they sell in the US, but they're amazing. I mean, they don't look like anything like, they're just very sexy. So that's nice. And for incontinence, I just came out, I couldn't get the grip of a picture, but it's a product so that you put in, for women that have urinary incontinence, and it's also very common in myotonic dystrophy. And it's a small product that you insert inside, and it prevents leakage. So then you can go, and it's not a pad, you know, so it's also very nice for that. And I'm gonna look into it because I've got 4 kids, so it's gonna be nice too. So that was a personal issue as well. So when I go running, you know, I cannot drink while I'm running, and when I run an hour, it's not fun. So that will be nice. So, you know, we all have all of our issues. So I always want to relate that this is, you need to take it as we all have, everybody has issue, and we have similar issue as you do, but you got, you know, it's a different perspective. But there is products that are developed for other population. So now I found it so nice. The quadriporter, you know, the 4 wheels, not wheelchair, but the one that are, how do you say it, 4 wheels?
Yeah, this scooter.
Okay, so what I love now, with the aging population, they are asking for a bicycle trail. So not all my patients can use those, what do you call that?
Paths.
The path. You know those paths that the bicycle can go in? So now our patient can go in with their scooters. And so that increased the way they can access the environment. So that was very good. So anyhow, so thank you so much.
And then
I will put it in my presentation.
And then I had a question.
Yes, go.
My family member is increasingly having issues with swallowing.
Yeah.
Whether it's pills, whether it's some of the food you mentioned. Yeah. She's just having a much tougher time in the last year than in the past. What's your advice about the right way to start addressing that?
Yeah. Well, first, I wouldn't give any specific advice because you need, but I think you really need to see either a speech therapist or an occupational therapist for assessment. And they really will help her specifically, that your family member, to look at the different food option that you may. And there's a lot of product. There is product that you can thicken the liquid, so it's a little bit more thick. It's easier to swallow. There is a way to prepare food, so it's easier to swallow as well. The pills, there is also options that you can put in little gels or little thing that make it easier to swallow. Or sometimes you can also ask your pharmacist, because sometimes the products come into pills, but it can also come into liquid. They don't offer it on a regular basis, but it does exist from time to time. So if this is exactly what I'm saying, difficulty swallowing pills, you need to get a consultation, a good assessment, and then a personalized, review of what you can eat and not. And and there's a lot of option, as I said, for that. So I think that's my word. Yeah.
Just on that same topic, my brother had a hard time with that, and one thing that helped him a lot is he would tend to choke at the beginning of a meal, and if he had some yogurt,
Yeah.
even a yogurt too, and just like that consistency to start with, then he did much better. So just as a option.
But probably because, some of them have a lot of myotonia, so probably it helped with relaxing the muscles, and it was easy to chew, he didn't choke on it, and then it's more effective in terms of chewing and all this. So I need to write that down too. Other questions? Trick suggestions? So you have a 10 minutes break, enjoy it.
Let's have a big hand for Cynthia.